A mouth, a plane, and a spray bottle. The Norwegian ear, nose and throat specialist and researcher Per Gisle Djupesland made a connection here. And this led to an ingenious invention. This nasal delivery device, innovative in form and function. How did it come about? As an ENT doctor, he treats patients with inflammatory nasal and sinus diseases. For decades, medication to reduce inflammation has been sprayed into the nostrils using conventional spray bottles. But these pumps have drawbacks. To prevent medicine delivered in the front from dripping out, the patient tends to sniff. Then, the medicine runs along the nasal floor to the back of the throat and is swallowed. This is not where the medicine should go. A gamma imaging camera makes the dilemma visible. The medicine, visualized here in yellow, actually ends up primarily in the lower part of the nasal cavity, but it should reach all surfaces. Like this, going higher and deeper to treat the entire area. Since the medication fails to reach its targets using a conventional spray pump, then a better device is needed, he thinks. And so, the surgeon and researcher begins looking for solutions. What we see from the outside is like the tip of an iceberg. We see that there are very complicated structures inside, and that the nose and sinuses extend deep into the head. Medication intended to treat inflammatory nasal and sinus diseases must pass through narrow passages before it reaches the deep target sites. The nasal airways also change dynamically with every breath. When I breathe in through my nose and out through my mouth, the airways in my nose become narrower. Conversely, if I breathe in through my mouth and out through my nose, the airways in my nose widen and open. This potential of exhalation is one of the mechanisms we exploit in our delivery method. So, in order to deliver the medicine to target sites in the nasal passages precisely and without loss, it would be better if the passages were dilated during delivery. But the challenge was to find the perfect interplay between the nose and the mouth that could exploit the aerodynamics of exhalation. I remember very well the moment when I got the idea, that eureka moment. I was sitting in an aeroplane, and of course I was thinking about the airflow, and how we could use it better and modify it, and how we could use it to improve the drug delivery in the nose. This was right after takeoff. Suddenly, I had the idea and thought, that's it. It was now clear to him. The exhaled airflow and positive pressure needed to be redirected into the nose to exploit the forces of the exhaled air, and the device needed both a mouthpiece and a sealing nosepiece. Back in Oslo, he tells his wife Helena about it. The flash of inspiration fundamentally changes their lives.
Det ville ikke vært mulig uten Helena.
Yeah, the first thing I did was tell Helena about the idea. Oh yes, and what did you say then?
I said if the idea has commercial potential, we have to apply for a patent.
And that's what we did. Djupesland puts his ideas on paper. What's clear is that his device will have a nosepiece that seals one nostril. And it's connected to a mouthpiece that you can blow into. Something absolutely new.
We had complementary roles. Per had his expertise as a doctor and scientist, and I had mine as a businesswoman and lawyer. So we complemented each other with our respective skills.
And the device really is impressive. With the device in position, pushing the spray bottle up opens an internal flow valve to simultaneously release the airflow and the medication, which is blown high and deep into the nasal cavity. Blowing into the mouthpiece closes the soft palate, the connection between nose and throat. The exhaled airflow turns sharply in the back of the nose and escapes through the other nostril, having delivered the medicine to the target sites. The medicine cannot be inhaled during delivery. This method allows for effective treatment of nasal polyps and even migraines. It's even possible to administer vaccines through the nose with our device. Per and Helena Dupaslan start the journey to make their exhalation delivery system market-ready. In 2000, he and his wife co-found Optinose AS in Norway. And the success story continues across borders. In 2003, they expand to Great Britain. In 2010, they move to America, and Optinose becomes a US company based in Pennsylvania. In 2017, a drug-device combination product for treatment of chronic sinusitis with nasal polyposis is approved and rolled out on the US market.
It's great that it's gone this far, that it's gone from an idea to a patent and to products on the market, and also that patients can now really benefit from it.
Yes, it's a very good feeling to know that people really benefit from it. And that's what makes the two of them especially proud.